Hi, it's Lauri Kane from the Plastic Surgery Office of Dr. Dean Kane in Baltimore. For those who know me, you know my love of Sculptra. You know how much I love how it stimulates collagen and elastin under the skin. And how I have my yearly tune-up with Sculptra with the 2 vials. I thought it'd be interesting for people to know the history of Sculptra. It's a pretty fascinating story. So back in 1999, Sculptra was first developed specifically to help the individuals who had HIV/AIDS. They were trying to deal with the hollowing of their faces. And they recognized there was a polymer called polylactic acid. And it was, it's something that they figured out when it's put into fine crystals or fine powder and reconstituted into antibacterial water and injected under the skin, it stimulated collagen, elastin, and filled out the hollow. Well, what happened was back in 1999, the company who first created Sculptra didn't quite realize reconstitute it properly. And then it was the way it was injected. It was somewhat injected as you took a whole syringe and they tried to fill the whole area with one syringe. And as a result, what happened, the individuals who were injected this way wound up getting a lot of nodules, the hard nodules. And so Sculptra kind of had a bad rap for a very long time because of the consequences that we had seen in 1999. And so Sculptra came back to life again, probably about 15 years ago. In our office, we really, Dr. Kane still kind of kept it didn't start using it, still concerned with the nodularity of that it was producing in those years. So we waited another 5 more years, even after they figured out how to reconstitute it. So we started back using it, or we didn't back use it, we started to use it about 10 years ago, which was, it's 2022, so about 2012. And we were shown that it had to be reconstituted a very special way. It had to be injected in a very special way. And before Dr. Kane even started to use it, we actually went around the country where he actually watched the main physicians who were the main injectors of Sculptra do their injections, learned how they reconstituted. So we went to Dallas, we went to Los Angeles. We then were taught, he was taught by the most famous individual from Belgium who came to the US, who actually taught the American plastic surgeons how he used it in Europe. So after really researching it and learning from the experts in the world and throughout the US, Dr. Kane decided, okay, we're going to start using Sculptra now that we know how to use it properly. So we know how to reconstitute it, we know how to inject it. And Dean came up with his own way of thinking of Sculptra. So Sculptra he likes to think of the face as a grid, so that you get this very nice equal distribution of the Sculptra. And the Sculptra can be injected from the temples, it can be injected under the eyes, the whole cheeks, around the mouth, and I personally do Sculptra in my neck as well. And the key about Sculptra has the 5-5-5 rule. Dr. Kane has his 6-6-14 rule. And that is that 5 times a day, for 5 minutes a day, for 5 days in a row, you are to massage the face. So that was something that was learned over the years, that in order to prevent the nodules from forming, we reconstitute it correctly, we inject it correctly, and then the patient has responsibility of just having to massage it, and we give you the massage cream to use. And we really don't get nodules. It's pretty rare that we get nodules, super rare. And if they are, they're tiny, that can really most of the time just get massaged out. And then if they really can't get massaged out, then Dr. Kane will inject it to dissolve it. So we don't have the nodule problem. And it's just a phenomenal product because it really does stop the aging of the face because it forces your skin to produce collagen. It really does stimulate all the beautiful properties that make your skin creamy. And so we have a huge practice of patients using Sculptra. We have patients come every year for their Sculptra treatment. So the way we work Sculptra is for the first time you ever do Sculptra, it's designed where you have to do 2 sessions, 6 weeks apart. And then for those after that both sessions, your face will be consistently stimulated by the Sculptra for an entire year. So by the end of 1 year, your face looks younger than it did when you started. And then we recommend that you actually do your Sculptra the anniversary of your first one, not the second one. And so therefore, you continually, you don't let your skin stop that stimulation. So you do your annual one-time treatment of Sculptra every year. And I promise you, you will look younger than you did when you first started. And we will show you the following pictures of an individual and myself who has been consistently using Sculptra and has stopped the aging of our faces. So if you really want the fountain of youth, this is it, Sculptra. And then I always top it off with a chemical peel, a TCA chemical peel on top. Again, I believe in stimulating the top of the skin with underneath the skin. You get this double tightening, double firming, and you get a face that truly is creamy, tight, firm, and doesn't age. All right, give us a call, 410-602-3322. I'm always here to talk to you about it. I have a passion for it, as maybe you can't tell. I want to be dipped in it. I want to be everywhere on my body. And we do use it all over. We do use it in the arms, the crepey skin. We do use it in the legs. We do use it in the buttocks. We use Sculptra everywhere on the body. It's an amazing injectable. All right, we'd love to see you.